So we'll come
Recording
back.
in progress.
So the problem with Dr. Z, as we said, he had the problem with the attachment. When he doesn't feel connected with his wife, he feels so miserable, he feels so anxious. We said anxiety is when we have unfulfilled uh, life. And he was unfulfilled with his wife because he is not connected to her. And we said attachment is so essential, and that's why he feel like he will not be able to survive without a wife with him, and that's what caused him to have all of his anxiety. Because as we said, anxiety is fueled by when we have no attachment to anyone. Uh, a treatment for Dr. Z with anxiety is we use usually psychotherapy. As we said here, we make him self-aware of what's going on, and we give him anti-anxiety medication that increase serotonin in the brain. We said in anxiety we have low serotonin, so we give him medication like SSRIs, which help with the calm down the amygdala, which is the source of our anxiety, and activate the frontal lobe, which is not very active during anxiety. What should we do for Dr. Z as lab? When we see somebody with anxiety, we need to do some basic work, like we do physical exam, we take very good history, we check for substance abuse, we check for alcohol, benzodiazepine, hashish, anything that patient. We check for thyroid problem. Thyroid problem always can manifest as anxiety, and we try to have very comprehensive look at what's going on with him. Okay, and this is the medical workup. I put you a slide for it. Differential diagnosis of anxiety, as we said here, we have to differentiate anxiety from panic disorder, agoraphobia, specific phobia, and generalized anxiety. So we're going to talk about the others now in the next slide, so you will know how to differentiate between panic attack and general anxiety. So we're going to explain that in the future slide. Now we'll move to the second subject. Now this slide here is to show us how to diagnose the illness. For example, if the patient had history of trauma, then we'll check for post-traumatic stress disorder. If he had history of excessive cleaning and excessive checking, that's mean OCD, because all of this will come with anxiety. And we know every patient has different diagnosis and different treatment. Now we'll move to the second part of our lectures, which is social anxiety disorder. Social anxiety disorder is very, very common. It's one of the most common illness in the world. In America, is the third most common psychiatric illness. In Saudi, it's very, very also common. It's more in female, as we said. Is a form of social anxiety. That means we feel stress in social situation. It usually starts in childhood. So the patient in childhood will be shy and isolated. It has some behavioral temperament that he is not overactive and he is not spontaneous. He'd like to stay by himself. He had difficulty expressing his feeling was as a child. Usually, patient does not come to see us because of social anxiety. They come for depression or for other reason. They don't usually come. Nobody will come and tell you I have social anxiety. Very rare. Most of them, they come for depression, and then you discover during the treatment that they have social anxiety. So those patients usually does not go to party. They don't like to socialize. They don't like to be invited to iftar or dinner or anything. They like to work at night time. Why? Because night shift, there is nobody around. They will never eat in public, for example. They will be shy to eat in public or eat in any social situation because they fear what's people gonna criticize them if they do that. So that's why they're feeling. Lifetime prevalence is 12%, so it's very, very common, and usually start in adolescent illness. And يعني, it's very common in those patients. They like, as we say, to stay at home most of the time, and they like to have a night shift. They work in the night shift. They fear public speaking. So public speaking is very famous form of social anxiety. Remember, in America, public speaking is the number one fear. Death is number seven. So you can imagine how common this illness is. As we said, people are afraid on any social situation. Um, I don't know. The main fear with them in social anxiety is judged by others, scrutinized by others. So the reason why they don't do a good job in anything because they are fearful of people, what they're gonna say about them. So this is the main fear. So what is the main fear in social anxiety is fear of negative evaluation by other. This is a question in the exam. What is the most common fear in social anxiety is fearful of negative evaluation by other. They feel rejected also, fear of scrutiny, fear of social inadequacy. So I don't have a Rolls Royce or a Mercedes, so I cannot go in public because everybody have a Mercedes and I have a Ford Escort, for example. So that what make them humiliated, and this inadequacy is part of that. The same problem in social anxiety is with anxiety, where the limbic system, the amygdala, is hyperactive in those patients. And the amygdala will make them so anxious when they are in social situations. So social situation will trigger the amygdala to make them feel fearful and anxious. It always starts in childhood. So in childhood they being bullied يعني بنقول تنمروا عليهم وهيك تنمر. So as a child he was bullied probably. He was as a child he avoid all social situation. He would never, like for example, do any activity in school, like doing a play or doing other activities. He will be isolated as a kid, and they have insecure attachment as a child. So let's go into insecure attachment as a child. So here is what the childhood. Let's take a case of Amani. Amani is a 42 years old female experienced severe anxiety related to her job and social obligation, which had led to avoiding leaving her house. Her anxiety is rooted deep-seated fear of being scrutinized and found lacking. So Amani is isolating herself at home. She is fearful when she goes to her job because she will fear that people will scrutinize her, ينتقدوها, because she is not doing good enough job. So she will not be doing a great job at her work. The fear of not doing a great job is rooted in her uh, in her psyche, and that's why she is isolated and she has no friend and she had no family around. She cannot meet new people in any social situation. She afraid like people will look at her different and scrutinize her looking or scrutinize her makeup or her dress and look down at her because she will not be as good as any other person around her. Uh, Physical and emotional symptom, she experienced bout of crying and depression. She suffers sweating and panic attack when she is in social situation. She will have a dry mouth, pounding her heart and shaking and tremulous when she is in social situation. So this is typical of Amani as a case of social phobia or social anxiety disorder. So it's the same field. It goes deep to the childhood. Amani told us that when she was a child, her father used to tell her that he always criticized her job. He always tell her this is not good enough. And that's word rooted in her unconscious mind that she is not able to do any good job because her father told her that. Remember what our father and what our parents tell us, it will stick with us forever. Because if your father say you are bad, because we feel that father knows us more than anyone else. So the word of the father will be rooted in our uh, psyche. I remember one guy, and this is a story, don't laugh at me here. There was a professor in America. He was 70 years old and he was given a very, very high prize because of his accomplishment. And we were sitting near him and we asked him, you should be proud of yourself. He said, no, I feel like this, yani, I feel so bad. I asked him why. He said, when I was young, look at this word, when I was young, my father told me the difference between you and the donkey, يعني الفرق بينك وبين الحمار, this is what we say in Arabic, that the ear of the donkey is a little bit longer than your ears. So this word, his father was angry at him and he said this word, but this word stuck with him forever. After 60, 70 years, it stayed with him all the time. He never got out of that. And the same thing is Mary here. When her father used to criticize her that you did not do a good job or this is not good enough job, it will stick for her with her forever, and any job she will do in the future, she will have in the back of her mind that my father always know the best and he told me that I will not do a good enough job. And that word and that behavior, which comes with her since childhood, stuck with her forever and shrunk her social activities. ليش؟ لأنه she cannot meet new people because she will afraid that they will say the same thing what her father used to tell her. So as a child, the reason behind social phobia is either having an aggressive father or aggressive mother criticizing you, or having a cold mother. She any cold mother. Look at the mother of this baby here. Look at the up and the down. Look at the mother up, how vivacious, يعني full of energy, motivated, مليئة بالحيوية. حيوية means vivacious. Look at the down woman, flat affect. The baby take his mother as first object relation. ايش يعني first object relation؟ يعني the first human being you learn to meet as a child is your mother. And if the mother is flat and cold, emotionally cold, then you will resemble her feeling and you will have the same feeling like her, and you grow up to be flat and you grow up to be fearful because your mother was flat. You grow up to be fearful because of that first object relation. So always you need to make sure that when you have kids, you smile with them, you play with them, because this is what make their brain grow. This will make them feel social and not feel fearful in social life. So most, not everybody, but most of the people with social phobia, they have either father who criticized them or a mother who was flat or cold, emotionally cold mother like this one. And that what causes, look at the difference here. Look at the lady here. Look at the lady here. And you see the difference. Having no facial expression usually ruin the life of the kids. And I always tell my patient, you need to take care of your wife and make her happy. Because if your wife is sad and depressed and had no emotion, you are going to pay the price with your kids. Your kids will suffer and have social phobia. So even if you don't like your wife, you have to make her happy all the time so you don't pay the price in your children, because they will grow up to be having social phobia because the mother inability to connect with them. So what you call first object relation is the mother face-to-face interaction is a mirror that reflect acceptance and delight. That's mean when you came to the world as a child, you are welcomed, you make people happy, so you feel happy. But if your mother is sad when she sees you, that's mean you came to this world and you didn't make people happy and you feel bad about yourself and you feel inadequate because you did not connect with people with you when you grew up. So when you see your mother happy, you feel safe and you feel loved and you feel like you deserve to be good in the future. So we said the criticizing father or indifferent mother is the reason for our social phobia. Either father who was aggressive and always look at you, you are not good enough, you are not uh, smart enough, you will do a horrible job, or mother who was not, or both, or the mother also could be critical. So always you have to be good with people and connect with your children and show them that you like them, and you don't criticize them. There is a huge difference between this lady here and this lady here. See the huge difference? Vivacious lady, this girls will grow up to be very, very social, very happy because she is welcomed by her mother. She make her mother happy. This lady feel like I did not make my mother happy. My mother did not like me. That's mean everybody else will not like me because your mother is your first object relation. Means the first person you exposed to as a child. And that's what causes social phobia. And as we said here, the most fear in social phobia is fear of being judged by other people. This is what is common. Treatment for social phobia is usually a combination of psychotherapy and medication. So we give SSRIs, beta blocker, benzodiazepine, and we do CBT like cognitive behavioral therapy. But the most important things is always combination of psychotherapy and medication. So if you have a question in the exam, what is the most important treatment for anything? ADHD, depression, social phobia, always combination of medication and psychotherapy. Now we'll go to panic disorder. And panic disorder usually come as sudden. So you are sitting in your chair and you suddenly feel your heart is beating fast. So we call that panic disorder. Panic disorder usually start suddenly and subside suddenly. So you have 10 minutes, you feel you are about to die, like suffocating, your heart is pounding, you are trembling, you are smothering, you have a chest pain, stomach pain, nausea, dizziness. You feel also that you fear of losing control, and you feel derealization. Derealization, يعني you feel like you are detached from the reality. You feel like you are out of life. Okay, and usually severe pain because of the locus coeruleus secrete a lot of norepinephrine. So we said locus coeruleus is secrete norepinephrine, and it's secreted in a certain way. Like in panic attack, it will be like it will secrete a huge amount of norepinephrine, and that what causes you to have panic attack. In anxiety also there is a huge amount, but in panic attack it will be 10 times as much. So is a panic attack is an extreme anxiety for 10 minutes. So it will happen like for 10 minutes, and you feel like you are about to die because there's a huge amount of norepinephrine secreted from the locus coeruleus, which is come from the amygdala. So the amygdala will sense a danger, and it will make the locus coeruleus secrete all of these panic attack. And let's take the first case of panic attack, and this is an Andy. And Andy, actually his real name is not Andy, but because he is from India, so I call him Andy. He is a doctor, came to my clinic one time, like 20 years ago. I was just here in Riyadh. And Andy was 53 years old, Indian doctor, a very good doctor, mashallah. And he was driving on the Khares Road, this traffic light on Khares Road, and he stopped like two times, and then he had panic attack on the traffic light. So he was driving, and then at the traffic light, he had this panic attack, which is similar to what we said: heart pounding, sweating, feel about to die, feel like he is about to lose it, as we said. And he had this heart felt dizzy, fainted. He was so panicking. He came to me in this way, exactly like this. He said, Dr. Ali, this is what happened to me. I felt like I'm about to die. Then he felt like he is losing control. He was sweating. He was, he feel like he was run out by a train. after this panic attack. Panic attack really can drain you. So the first thing, since he is 53, the first thing we check his heart, because he might have a heart attack. So we cannot jump quickly and say that he has panic attack. He could have really a heart attack. So he went to the ER, and the ER told him there is nothing wrong with you. Go to see Dr. Ali. You have a panic attack. So we need to do first cardiac workup, medical workup before we do anything. So you don't quickly diagnose panic attack. You just do your job in clearing the patient, because he might have a heart attack, or he might be coming off drugs. For example, if you are alcoholic and you stop using alcohol, you will have a panic attack. Or if you use hashish and you stop using hashish suddenly, you will have a panic attack. So panic attack usually is happen not as a result of coming off drugs, or not a result of medical illness. It just come for no reason. Okay. So this is the difference between generalized anxiety and panic attack. Generalized anxiety is usually ongoing, slow, you have increased heart rate, you have sweating, but this going on for days and years sometimes. And in panic attack, it's 10 seconds, 10 minutes, your heart rate is up and you are about to suffocate, and then it slow down suddenly. So it comes suddenly and it will subside suddenly in term of 10 minutes. Okay? And this is the DSM-5. We need to know all of that. So you have to have palpitation, sweating, smothering, shaking, sensation, feeling about choking, chest pain, fear of dying, all of that, which happened. Look at the word unexpected. So it happens suddenly, and it will subside suddenly after 10 minutes. And the reason for panic attack, as we said, is the amygdala feel there is something wrong, it senses some danger, and it will send a message to the locus coeruleus, which is increase the frequency of the norepinephrine. So panic attack is when you have way too much norepinephrine secreted in your blood. Instead of having 5 norepinephrine in a second, you will have 500 in a second. So that's what is anxiety. So the amygdala usually feel like you are running from a lion. But always you need to see which is the lion. Where is the lion? Where is the lion coming from that causing the panic attack? So let's see how we can analyze this case of... So panic attack is a amygdala imagining there is some danger going on, and it will activate the fight or flight response, which is the panic attack. So in anxiety, the patient's amygdala will send a message to the locus coeruleus. Locus coeruleus, there is something wrong here. We are chased by a lion. That lion could be anything, could be a job, could be a fiancé who is leaving you, could be bad news, email, will trigger the panic attack by increasing the locus coeruleus secretion of the norepinephrine. So this is the normal calm situation. And here the panic attack, and you see explosion of norepinephrine because of the hyperactivity of the amygdala and the increasing the norepinephrine secreted from the locus coeruleus. Remember, locus coeruleus is where we secrete our norepinephrine. So norepinephrine is the body of the locus coeruleus is where the body of norepinephrine located. So when we look at Andy, tell me what's going on. I ask Andy, first question is, when you put your head in the pillow, this we call psychodynamic, what will be going on in your struggle? What comes to your mind? He said, Dr. Ali, when I put my head in the pillow, I think about two things. I want to go and live with my parent in India because they are alone. But every year I postpone that going because I want to make a little bit more money. So I want to stay in Riyadh. So he said, I want to stay in Riyadh to make more money. So every year I say, next year I will go back to India and be with my parents so I can get a little bit more money. So he is waiting for more money to be independent so he can go back to India and live with his parents. At the same time, he feels guilty because his parent is about 8 years old, and he feels guilty about leaving them alone and not being with them in their old age. So the struggle with Andy here, we said always when we have anxiety and panic attack, we need to ask what is the struggle in the unconscious mind. And the struggle in the unconscious mind of Andy is money and being with the parents. So this is what we have. So the panic attack here is reminding Andy about the struggle in the unconscious mind between the money and being with the parents. So if you look at the psychodynamic, is the id want the money. The money is very important and I need to survive. The unconscious mind or the superego here, the superego telling him if you need to feel guilty, it's a shame that you are not with your parent and they are about to get 8 years old. They will die before you go there. And he always have this struggle on his mind. Always have this struggle. Should I stay here or should I go back with my parents? I'm 53. Should I stay in Riyadh? I don't think you should stay in Riyadh if you are 53. You should not stay in Riyadh at any age, I guess, but I'm just kidding here. But at age 53, you should be back with your parents in India so you can take care of them and have birrul walideen. Okay. At the same time, he is now. So anxiety is the conflict between Andy and should I keep making money here or should I go back and be with my parent? This struggle he used a defense mechanism called repression. Remember we said Dr. Z used reaction formation. Here he used repression. Repression is you have this feeling and you bury it down so it will not interfere with you. So repression is when you have an urge or a feeling, but you repress that feeling so it will not bother you. So we call that show repression. Repression. Right. So what happened is the struggle between the money and being with the parent and repression is what he used as a defense mechanism. Now, why Andy had the panic attack at the traffic light? So as a doctor, we need to be like a detective. Why you have it on the traffic light? Why you didn't have it in the bathroom? So unconsciously, we said, this is our own explanation that the traffic light reminded him of the waiting he has been waiting. So the traffic light is a symbol of waiting. So he said when he saw the traffic light, he had this feeling, guilt, struggle between the money and the parent. And that struggle, he buried it down. But the seeing the traffic light is what triggered that feeling again and make him feel panic. So we said here is psychodynamically, naturally we feel nervous when you approach unavoidable conflict. So he had this conflict in the back of his mind between should I make money here, stay here, make money, or go back and be with my parents in India. But he buried this struggle in the unconscious mind, but the traffic light kind of bring that to life again and make him feel anxious. So this is what happened. So it's boiling inside his unconscious mind between the need for the money and the need to be with the parents in India. That struggle is boiling, but when he saw the traffic light, it kind of like broke that feeling and brought it back to life, and he had panic attack because the traffic light reminded him, Andy, you've been waiting every time, you're waiting year after years. There will be time where you will not be able to go and be with your parents if you waited a little bit more. So this is what happened to Andy. All of this struggle, which was going beneath the surface, came to life and make him feel anxious and irritable again. So the repression, which he put that in the unconscious mind, the struggle between his parents' need and his need for money, that repression, we call that repression, is when you put that aside and never bother you. Why? Because Andy wants his frontal lobe to working. As we said, Andy is a doctor. So as a doctor, you need to have your frontal lobe always working because you cannot function as a doctor if your frontal lobe is busy or preoccupied with anxiety. So Andy was able to push that feeling of struggle down, but at a time where this struggle exploded and Andy could not take it anymore, he cannot repress that feeling anymore, and it came and caused him to have panic attack. So panic attack happened when that defense mechanism failed to protect Andy from that struggle, which is repression. Now, the traffic light make Andy more aware of what's going on in him and cause him to have a panic attack. So here is what happened to the DMN. The DMN here is the default mode network is the silent part of our brain, and now the DMN become explode because she cannot take it and deal with the struggle of the life. So Andy here, he had a lot of guilt feeling about his parents. He feel like he did not help by staying away in Riyadh and leave his parents in India. That feeling of anxiety and uncomfortable was able to keep it down in the unconscious mind, keep it out of the thinking brain. Why? Because Andy need that thinking brain to be as a doctor and function as a good doctor. So he was able to keep that feeling for a long time. But the traffic light kind of trigger that repression. And in conclusion, the red light likely serve as a symbolic trigger representing the feeling of being stuck or stopped in his life, unable to move forward in his decision about his parents. So the traffic light reminded Andy that, Andy, you've been waiting for a long time. It triggered that feeling of guilt about his parent and his need for the money. So we call that the traffic light is the symbol of what caused him to have this panic attack. And in panic disorder, as we said, we have plenty of, I'm sorry, in panic attack, there will be the brainstem, the locus coeruleus, which is the center of panic attack. The center of norepinephrine will secrete a huge amount of norepinephrine, making the patient have severe and the patient will tell you, I feel like I was run out by a train. Yani the huge increase the norepinephrine will make you smothers with anxiety and make you feel so tired like after having a seizure. It's exactly the same feeling. You feel so run down. You feel run down and you feel because of that increase in the norepinephrine from the locus coeruleus. So the treatment of Andy will be also psychotherapy, but we can give him either SSRIs and GABA drugs. SSRIs and GABA will also inhibit the inhibit the amygdala and inhibit the locus coeruleus. Both of them. So treatment will be benzodiazepine like alprazolam, diazepam, and SSRIs because both of them will inhibit the amygdala and inhibit the locus coeruleus. So they inhibit both the amygdala and the locus coeruleus. So this is how they work. Also, we need to tell Andy that he need to do exercise. Why? Because exercise will increase serotonin. So part of any patient who had panic attack or anxiety, part of the treatment, not only medication and psychotherapy, but also you need to tell him that you need to do exercise because exercise will increase your serotonin. Okay? Okay. So, and also some people will do rocking. Rocking will make panic attack better. So if you are uh, rocking will increase the endorphin in the brain. When you rock like this, it will secrete a lot of endorphin in the locus coeruleus, and endorphin will block the locus coeruleus. That's why if you have a 2 years old at home, I remember when I used to have 2 years old baby at home, she wake up in the middle of the night and just swing her a little bit, it will increase the. It's like giving her a shot of morphine because swinging will increase the beta endorphin to the locus coeruleus and make locus coeruleus calm down. Of course, benzodiazepine will increase the influx of chloride. This is how benzodiazepine work by increasing the influx of the chloride. And chloride is a inhibitory ion that will block down the activity of the cell. That's why I use them for anxiety and for seizure because they decrease the activity in the cell. They block down the activity on the cell. Right. Serotonin also will help because serotonin will one second please. محمد 10 دقائق انا بالغرفه تعال بعد 10 دقائق. الدور الرابع. So SSRIs also, when we give SSRIs, we said when we are anxious and we are panic, we need more serotonin because we get panic when we don't have enough serotonin. So if we give SSRIs will increase the serotonin in the synapse and make us less anxious and less panic. So treatment full panic attack experience in people when they misinterrupt bodily sensation. So part of the treatment of panic attack is to give them psychotherapy, because psychotherapy, we teach them that if you have a bad news, how to deal with the bad news. Like when you see the traffic light, how to deal with the traffic light, what is the meaning of the traffic light. So this is our job, to teaching the patient in the panic attack. We also teach them how to breathe, because when you have panic attack, you can't breathe too fast. So part of the panic attack treatment is to teach the patient how to breathe. So I will sit with the patient and tell him how to take a deep breath. So we'll tell them, like, take a deep breath for 10 seconds. Like hold it and then zephyr or exhale after 10 minutes, after 10 seconds. So teach them how to breathe slowly. This is part of treating anxiety. We also give them medication to uh, deal with panic attack, because the most fear after you have a panic attack, the most fear you're going to have is having another one. So most people, when they have a panic attack, they have a fear of having another panic attack. So for that, I give them a medication to keep them in their pocket. So I tell the patient, whenever you feel the minute that, because we say panic attack happens suddenly, but a lot of them will have a feeling before that come, like seizure. You have an aura. Same thing, panic attack. You will have an aura that you know that panic attack is coming. So you will put this Xanax or clonazepam in your pocket. Whenever the panic attack come, you can put one in your mouth. And so what is the most fear of having a panic attack is the cycle of having another one. Fear of having another panic attack is also can cause you to have panic attack. So this is a medication we used to give for a patient called Klonopin wafer. So wafer means you don't need to have a water even. You just put it in your mouth. Now, there is something we call agoraphobia. Agoraphobia is always come with panic attack. So we always say that you have panic attack with agoraphobia or panic attack without agoraphobia. So agoraphobia is when you have a panic attack, but this panic attack will make you stay at home and don't go anywhere because you fear in front of people you're going to have another panic attack. So we call that agoraphobia. Means you will not go to any crowded places, like you will not go to the mall or to for example, Riyadh Park or any place where there is a lot of people. Now, we finished here, but there is a lot of things here I want you to read on your own to help you with the USMLE and the OSCE exam. So you need to read that. You might not have a question from them, but you need them to clarify things for the exams. So here we finished, and I will leave a few minutes for question and answer. I hope you enjoy the talk, and I really don't like to do things in Zoom, but we have to do it now. I don't know why. Panic attack will represent with heart attack palpitation, even if there's cardiology related. So what happened is there is similar symptom between heart attack and panic attack. So to be on the safe side, before we'll tell the patient you have a panic attack, let's do a check and make sure that his heart is okay. So if you have a question in the exam, always make sure that you do the heart workup first before we diagnose him with panic attack. Any other question? Okay, wonderful session. Thank you. Okay. So we'll see you tomorrow, inshallah. We'll talk about mood disorder tomorrow. Uh, and hopefully we'll be able to finish mood disorder tomorrow.